Good evening, good evening. Welcome to Access Your Inner Wisdom. I am your host, and we are excited to get into our evening's live show. This is Access Your Inner Wisdom, and we are streaming live from GPAT TV right here on Facebook Live. This will certainly be recorded, and you can find us on all of your social media platforms. I am so excited this evening on this sixth day of February 2024 to bring with you some educational information from a phenomenal woman who I truly can call a friend. For those of you who are chiming in or who will see this airing, grab those who will be interested in what our evening's topic will be. Today, we will be sharing information. We'll be opening up our chat line for the topic of dementia and aging, what we don't know. At this time, I am elated to present my evening's guest. This is a woman that I have fell in love with, almost like love at first sight. We are colleagues. She is someone that I look up to, and she is in the person of our illustrious Kimberly Williams. Hi, Kim. How are you?
I'm wonderful. Thank you, thank you, thank you for such a wonderful introduction. And you and I are like sisters. We have
Yes,
so much
right.
in common from the time we first met.
Yes, yes. I would like for you to introduce yourself. Tell us a little bit about who is Kimberly Williams, what are your passions, what are all these wonderful letters behind your name about? Just share a little bit with us.
Okay, thank you. I will try to be as brief as possible. I actually was a late bloomer. I did not go back to school until I was 30 years old. I have to say, I had a bit of an epiphany. My father, whom I love dearly, passed away. And he passed away in August. After the funeral, I went to work. I gave a 2 week notice. Didn't know how the heck I was going to do it as a single mom with 2 kids, and went back to school. Got my undergraduate at State, master's in social work at Carolina, and then I got my license as a licensed clinical social worker a few years later. I've got a lot of experience. I did when I got my master's. I got my concentration was in geriatrics. So, and
Okay.
did an interdisciplinary certificate at Carolina in aging. So I got a lot of experience in aging. I worked with Wake County before I moved to the beautiful large town, haha, of Bath, North Carolina. Um, and I've done a lot of training working with caregivers on how to work with older adults who may have a mental illness or who may have dementia. So I've got a lot of experience with mental health and working with older adults. And as far as my passions, um, animals, I have 2 dogs, a cat, a donkey, 2 goats, and hopefully we'll have a few more goats here soon. And I love flowers, and what I do in the summers, I grow my flowers and then give them away to people. So
Oh,
I
that's
don't keep
wonderful.
them for myself, I give them to others. And my husband and I are in the process in Bath of starting a church of our own. So those are my
Wonderful.
passions.
Well, that is so good to hear. You have given me so much that I didn't know about you, sister. And I'm very happy to hear how you were driven to be placed in the geriatric field. And for those of us that may not know what that fancy word is, it's simply an older person, right? Right,
Yep,
Kim?
yep,
It's
yep.
simply
We've
older.
tried a lot of different words to make it look pretty, you
Yeah, we
know.
do fancy. We do fancy, and that's good.
Mhm,
But we just want everyone to understand. It's just our grandmothers and our grandfathers and me probably. And I want to dig right in because it is important for us to gain more insight
sorry.
into um, dementia and aging. It's important for us to know that. It's okay. You already told us you're an animal lover, so I guess we're hearing them. No problem with that. Um, Talk to me, Kim. Tell me, What's the real definition of the word dementia?
So a lot of us automatically think dementia is Alzheimer's disease, and it
Yep.
really is not. So dementia is that overlying term. It's like an umbrella. So often we can think of the word cancer, and when we look at cancer, it's the big umbrella. And under cancer, we have different types: breast cancer, prostate, bladder, lung, brain. And dementia's it's kind of the same thing. It's symptoms of memory loss, language, issues with executive functioning. There's a whole different things, a lot of different. And then under that, you have Alzheimer's, frontal temporal or FTD, Lewy body, vascular, all different types of dementia. There's a lot. There's not just Alzheimer's disease. There's a lot of 50.
So let me stop you right there. You said the word Alzheimer's and you said dementia. Oftentimes I hear the two of those being treated as one. Slow it down a little bit and educate us. Is it Alzheimer's or is it dementia?
It's Alzheimer's. So dementia, again, is that overlying. And under dementia has 50 different types of dementia. Also,
So
different diseases.
Give me the first five popular ones.
Alzheimer's, vascular, Lewy body, which often runs with Parkinson's disease, frontal, Lewy body, vascular, frontal, Alzheimer's, and then there's a bunch of other smaller ones. There's one that runs with Huntington's disease, which is a genetic disorder. So those are probably the top five.
Okay. So if someone says, my dad or my grandfather is battling with Alzheimer's, is that politically correct?
Yes, because you can have that disease. And I guess one of the things that we should probably start saying, instead of saying Alzheimer's dementia, Alzheimer's disease, because it falls under dementia, but it's a group of dementia symptoms is what it is. Alzheimer's is a group of symptoms, and those symptoms are what dementia is.
Okay. And I want to say to those of us that are live, and I will repeat it again, you can certainly chat in your questions. You can chat in anything that you may be concerned with, whether it's for your loved one or just for educational purposes. Today, our topic is dementia and aging, what we don't know. So as you share with others, I know it's about 5 of you on, share with others. This is good information. And I want to ask you, Kim, beautiful Kimberly, discuss how society as a whole and those within our community use the word dementia, check this out of context. Where do they use it out of context?
We've all had moments where we forgot something. For example, you're at home watching your favorite TV show on TV and you think, man, I'd love some ice cream and a Diet Pepsi. And you get up and you go to the kitchen and you get to the kitchen and you go, what did I come in here for? And we all go, it's that Alzheimer's or old-timers disease is what we'll say. That old-timers disease. I can't remember nothing. And we think, we blame it on possibly Alzheimer's. It's not. It's usually we got too much stuff on our plate. There's a big difference. Okay. You go back to your seat, and when you about the time your butt hits that chair, you go, oh, gosh, yes, now I remember. And you get up and you get what you need. All right. So, but as a society, we automatically put a negative spin every time we forget something. Oh, it must be dementia. I must have that old-timers. I must have Alzheimer's. And it's just simply not true. It's just simply not true. And an interesting fact about aging is dementia, Alzheimer's, any of the diseases under dementia are not normal parts of aging. I hate to use the word normal, but they are not characteristic of what happens when we get older. Okay. We can lose some memory as we get older, but it's not a given, y'all. it's not a given that we're going to be forgetful and strung out there and just have dementia. It's not a given. In fact, our memory, we lose some spatial abilities, and as we get older, it may take us a little longer to learn things. Maybe, maybe not. Sometimes I think it's, instead of we say, oh, I can't learn that technology, it's really not that we can. It's just easier to let somebody else do it.
That's interesting. Okay, so that's food for thought. Again, our chat line is open, and feel free to chat in your comments and your questions. My next question to you, Kim, is what are some social and psychological effects of aging? Because if we haven't already experienced this with our loved ones, then we may coming in. Also, it's just good to know because we never know what's going to go on in our future, even with ourselves.
Right. So if you ask a group of young people or older people even, so what do you think about, what do you think when somebody's 75 years old? What do you think? Or we're hiring somebody new and they're 75. What do you think most people think? Blue hair, they're slow, they're going to fall, they can't remember things, they're going to hold us up. It's a lot of negative stuff, which again is simply not true. Do you know you can add, on average, just by having a positive psychological aspect of aging, when you have those positive thoughts about getting older instead of all the negative stuff, on average, people can add 7 years to their life.
Now, you know what? Slow down and say that again. Slow down and say that again. Because it's true.
It is. So just by having, we automatically think of all those, my bones ache, my bladder don't work like it used to. I got the gray hair and the wrinkles. We look at all this negative stuff about aging, and none of us want that. But there's some wonderful, great stuff about getting older. And if we can grasp those positive thoughts and hold on, what a blessing it is to make it into our older years. If we can hold on to that and stay focused on the positive, we can, science has shown you can add about 7 years to your life just by being positive about getting older.
And it does not cost us nothing.
No, doesn't cost you a thing.
7 years doesn't cost us a thing. I believe, I'm in total agreement with you on that. I'm a firm believer of accentuating the positive and eliminating the negative. Real simple. Oftentimes we miss the mark with that because you're right, Kim. We hear more than not. How you doing today, girl? Man, let me tell you, you hear that all the time. All the time. Let me let's see what's on these. Okay, so Shermel Berry. Hi, Shermel. She's saying that's me. She said, it's so glad to know that it's not part of our disease, Kim. So that is really good, for you to hear. I want to dig right in up with a few more questions that maybe people will want to know who watch this again. How do individuals, how do we adapt to change that we see in a loved one? I want to, before you answer that, I'm a person that has experienced that firsthand and kind of dealing with it now, not only with the obvious that people probably are thinking, my parents, just older relatives. And sometimes I be thinking it's me too. But Kim, go ahead and answer that. What are what things that we need to be conscious and aware to adapt to when we begin to see a change?
Educate, educate, educate. Support, 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 and reaching out. We as a community, and I'm not talking about just your neighbors, I'm talking about a community as a whole. We really, really need to be helping each other. And we need to be able to reach out to our neighbors and let them be a blessing to us. I have a wonderful sister who never ask for anything. Can I help you with? No, I'm fine. I'm fine. I told her that's going to be on her tombstone. I'm fine. But I told her, I said, every time you tell me that, you rob me of being a blessing. You take that blessing away from me when you don't let me help you. So when you see these changes, reach out for help. It's important. Chariesse, as a caregiver, you got to take care of you. And it can be overwhelming taking care of a loved one with dementia. It can be so overwhelming. There's a lot going on. You sometimes lose being a daughter to becoming a full-time caregiver. And that's hard. So we really need to be asking for help, reach out to those support groups, find those support groups, and educate yourself about the disease and about how to take care of yourself.
Okay.
Alcoholism is climbing among older adults because they're caring for their older adults. And guess what? You don't have to get somebody to respite care. You can stay home and use alcohol as a coping skill, and you don't have to leave. So we need to find those healthy coping skills, and that's digging deep within ourselves.
Yeah, because the alcohol one is not a healthy coping skill.
No,
Let me
no,
just make that clear. It's not.
it's
We have a
not.
question here.
Mhm.
Sharmel says, what are some of the diseases of older people that affect the mind?
Of course, you've got dementia. You've got a UTI, a urinary tract infection, which can make people all of a sudden agitated. They can become more confused. We've got strokes, vascular strokes that can affect the mind. Medications. As we get older, our liver and our kidneys process medications out of the body. As we get older, they don't work quite like they did when we were 20 years old. I think we can all attest that our bladder does not work like a 20-year-old anymore. It doesn't work. So
Well, not
sometimes
all of us. Well, not all of us, because we have young people watching this. So
true.
I
Well,
can't
as
let
we
you
get older,
come with that.
true,
But
true,
hold on
true,
one
true.
second. Time out
But
for a minute.
so the
Time out.
kidneys
Time out.
and the liver can.
Time out for 1 second. Slow
Uh-huh.
it down a little bit. I'm gonna tell you why. I like for us to digest what you're saying, give it some thought, and I'm gonna chime in a little bit. Of course, that hit very close to home for me, which we won't get into right now. What, and I hear you going, you're going well, Kim, but let me slow you down. What can we do to stop this? You say it's going to affect this, it's going to affect that. Some people use a coping skill with alcoholism. What can we substitute it with? What can we utilize, or digest to stop this? I heard you say education. Now
Uh-huh.
what? What else?
Taking care of yourself.
I agree. Coupled with that, it's easier said than done.
Mhm. I agree
What do we say?
100%.
Drink your water, drink your water, drink water. But what's happening to us? They want that Pepsi. They want that dark beverage. They want that coffee. Um, old
Mhm,
habits, old habits, right?
mhm,
Um,
mhm.
I'm gonna digress and let you continue.
Okay. So to 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 follow up on some of those other diseases of the mind, so medications, because as we get older as well, we may take multiple medications, and those medications can interact with each other. So again, how do we help ourselves with that? Education, education. And you know what? You have to advocate for yourself. And if you can't, find somebody who can. Take your bag of medications to the pharmacy and say, "Hey, look," to the pharmacist, "Can you go over these with me? Take them to your doctor. Is there anything maybe I can stop taking? Is there anything that's causing an interaction with another medication?" And that's just being advocating, being proactive for ourselves. Don't be afraid to ask those questions. Um, and write them down if you need to before you. That's what I do. I write my stuff down, because when I get in the doctor's office, I go, "Well, I don't know why. I don't." They ask you stuff, and you're going, "Well," you walk out going, "Well, I forgot to ask them that." Write it down. So be proactive in your medications, because your medications can cause issues with your thinking, especially things like steroids and pain medications. Um, those are the highlights of brain disorders that can cause problems with thinking and memory. And again, advocating for ourselves, educating. And you know what, Chariesse? I know it is hard to say, stop. This girl likes a Diet Pepsi better than fresh air.
And that's right. Thank you for that good example. You have one right there.
I do. I love a Diet Pepsi. It may not be something I'm willing to give up, but there are other things that I can give up that I'm willing to do this. I'm willing to do this. So it's baby steps. It's baby steps because it's hard.
Okay, it is hard and it's baby steps. Unfortunately, we oftentimes are a day late and a dollar short with doing those things which we should. It's hard. It's hard even for me. Um, Dementia and aging, the aging process. I want to shoot some questions out that individuals may benefit from when they watch this live repeated. And here we go. Want to give you a few of them and you can answer wherever you want. And we can go back over some and I can repeat some. The first one, we rely on memory, I'm sure you're going to agree, to get and keep so much meaning. You spoke about why dementia occurs. How is it actually diagnosed? Can you share with us?
That's a tricky question because there is no blood test.
No blood test.
No, they can look like if it's from a stroke, we can do an MRI of the brain, we can do a CAT scan, we can see that there's a brain bleed and know, okay, this person had a stroke, this is what's going on. As far as Alzheimer's disease and some of the others, there's no blood test. There's some testing that they can do, but it's not 100% accurate. So for those of you, and I know Chariesse has heard me talk about this, there is a book called The Nun Study, N-U-N.
Wait, tell me the title of the book nice and slow. What is it?
The Nun, N-U-N, Nun Study. Just if you Google that, you'll find it. It was done several years ago. It's very interesting because they had nuns who were coming in to the convent. They were 17, 18 years old, early 20s. They lived the exact same lifestyle for the most part. They all ate very similar. They lived a very similar lifestyle. These nuns agreed for this study that at the time of death, they would let the researchers do an autopsy on their brain.
Okay.
And what they found was a whole lot of, I'm going to say a whole lot of nothing, but it was a lot. So what they found for some of the nuns who exhibited signs of dementia, forgetfulness, problems with executive functioning, language skills, not able to work simple math problems, things like that, they did an autopsy. And surprisingly, what we call the hallmark of Alzheimer's disease is what we call plaques and tangles. So the brain is full of these dead cells is what they are. And these dead cells cause plaques and tangles. But what they found, some, not all, some of the nuns had signs of dementia and they had no plaques and tangles. And then they had a few nuns whose showed some mild cognitive impairment, but no signs of Alzheimer's, and they had a brain full of plaques and tangles.
Wow.
So we really don't know. And to be honest, they've gotten really no further in the research as to why.
Even here in the 21st century?
You got it, kiddo. Nope. They're trying, and they've made some progress in I was looking at something the other day that for treatment, it's pretty extensive and it's still exploratory, but they've made some advances, but still not a lot. There's still not a lot. And the U.S. is 8th in dementia as far as countries worldwide.
Who's first?
Finland.
Wow. So we are 8th.
Mm-hmm.
Wow.
Mhm.
Sometimes I know that people have asked, well, what caused my dementia? Is it true that it could have possibly been genetic?
Yes. So there is a gene, APOE4, I think is the name of the gene. There is a gene that's a marker for what we call Alzheimer's disease.
Okay, you said APON4.
APOE, the letter E, and the number four, APOE4.
APOE4.
But the issue with that gene, like almost, I'm not going to say all, but a lot of other genes, such as the gene for diabetes, all right, we may have that gene, but because we lead a healthy lifestyle, that gene never gets activated. Or if it does, it's way late in life before it ever gets activated.
So
So
it
you,
lays dormant.
uh-huh,
It lays dormant, correct?
right. And then in the environment, how we take care of ourselves, that could kick that gene. Like for diabetes, I may have the gene, but if I limit my carbs and I exercise and I don't have stress and I eat healthy and I have a good weight, that's probably not going to get activated. But if I eat poorly and I'm overweight, I'm probably going to have type 2 diabetes because I got the gene and it gets activated. And it's the
That's
same concept with Alzheimer's disease and a whole lot of mental health disorders such as anxiety.
that's thank you so much. That's really, really insightful. And that's a great point. Even when those of us who are watching now or who will watch, just think about yourselves, especially when you become of a certain age. We kind of know our bodies. You
Mhm.
touched on so many good things. There's so many things I want to comment on that you've touched on. Let me try to revert back and catch up to right now. When you get to these clinics and these doctors' offices, I've learned since I've relocated to the South here, we are more apt to say, okay, yes, thank you. But we
Mhm.
walk out the door not understanding what just transpired.
Yep.
And I come from a place where you can't rush me out of the doctor's office. Excuse
Mhm.
me, can you tell me what that means? Just like when we opened, you spoke about Alzheimer and dementia, and you said, I went to school for geriatrics. Well, some people don't know what that word means. They just don't.
Mhm.
Um,
Mhm.
I love to pause for our comments, but let me just continue a little bit. To those that are watching, think about what I'm about to say. If you don't understand a question that a physician or medical staff is giving you, it is so okay to ask because we're only talking about your life or your loved one's life. Don't be
Mhm.
so quick to walk out the door. And Kim, unfortunately, sometimes we do have, unfortunately, medical team members that do want to rush us out the door.
Oh, absolutely.
Respectfully, respectfully, one second. And I love what you said about writing things down. I think that's very important. Um, you spoke about the medication clashing, very important. We haven't been taught. We are late on gaining insight into all of this. I know you want to say something. Go ahead, Kim.
No, I was just going to add to the fact that if you can bring a caregiver with you to your doctor's appointments. I am so sorry. They have been quiet
Don't
all
even
day
worry.
until
Come on, this is we just live it. Just talk. We got you.
now.
We can
But
talk
bring
over
a
your
caregiver.
pooches.
What's that?
We can talk over your pooches.
Okay, good.
Oh,
So, but it's so important, and I have lived experience too. My mother had dementia, and she would go to the doctor, and she could not hear out of one ear, and he knew that, and he would always talk to that ear. So she would just sit there and smile and shake her head, and had no clue what he was saying, right? And he'd
right.
say, "Well, how is your back? Oh, it's fine." And if we were not there to say, no, wait a minute, mother, no, 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 no. Let's have a conversation about this. Let's talk about this.
Okay, so hold
So have
on, Kim.
a caregiver that'll advocate.
Hold on one second. And I love what you said. I totally agree. Now here, Sharmel again. This is our number one. She's gonna get a car. She gets a car. She gets a car. She states, can some elders that have been
Mhm.
misdiagnosed? She says some elders now are being misdiagnosed. So how her question is, how do you fix that? And she says also taking the medication for dementia, will it hurt you more? I'm sure she's saying, is it a long-term side effect?
Okay. So the first part of that question, are they being misdiagnosed? Absolutely. Because guess what? The symptoms for depression can look just like dementia. Forgetfulness, can't concentrate, sad, sleeping a lot, no appetite. That can all look just like dementia. And here's what happens. And we have a lot of wonderful doctors out there. And we have a lot of doctors that go, oh, well, honey, you're 80 years old. That's supposed to happen. No, it's not. No, it's not. So go to the right doctor. If you're not satisfied, go to a neurologist. A neurologist can work with you to diagnose dementia. Psychiatrist, if it's mental health, go to a psychiatrist, but go to a specialist and don't stop until you're satisfied. And that's
a neurologist. A neurologist is the study of
nerves, the brain. Mm-hmm.
And if we don't even know how to get there, we can certainly get
some places. Yes, some places. The Monk, MONK, the Monk Center in Greenville, North Carolina, is a geriatric center. Carolina has a great geriatric center. So go to somebody who specializes
for our locals. That's wonderful for our locals because we are live in Greenville, North Carolina. However, this is a worldwide live show. So let me jump down to that question. Name some places of assistance locally, Kim, and throughout our nation. Do we have any worldwide support contacts for those who may be watching outside of America?
For Alzheimer's, you have the Alzheimer's Association, alz.org. Easy peasy. alz.org. You can get information. North Carolina has the Dementia Alliance, which is specific to North Carolina. And if you're a YouTube person, Teepa Snow, Teepa Snow. Just put her name in YouTube, and she is
T what? T-E?
Teepa. Teepa Snow. Yep. She is fabulous at working with older adults with dementia.
Okay, hold that thought. You know, I'm gonna have you host because you
sorry.
No, don't apologize. So Maria is chatting and she states sometimes the doctor are not equipped to access a patient because they are not familiar with the signs of dementia. So Maria, that's where the referral to the specialist comes in. And Kim, you said the specialist is called a
neurologist.
And so
again,
you go ahead.
You can also look in your community, wherever it may be, at the hospitals that have a geriatric center. And those doctors know older adults, and they don't automatically go, oh, well, you're 80, you're supposed to hurt. You're supposed to be depressed. No.
Yes. And Maria answered her own question. She said, ask your doctor to refer you to a neurologist. That's it. That's key. Actually, let me post that for those who don't know how to spell it, because sometimes I get a senior moment and I don't always know how to spell things. Yeah, write that down. A neurologist. For those of you who view this again and this hits spot on for you, for your parent, your grandparent, your aunt, your uncle, your spouse, your neighbor. This is important. I am so happy Kim is here with us. I want to put up those names that you echoed, those organizations that you echoed and said that would be beneficial, because we are fortunate enough to have the World Wide Web. So there are no excuses, right, Kim?
Right.
You said alz.org, correct?
Yes.
And you also said they can look on YouTube to find Teepa Snow.
Yes. I don't know Teepa personally, so this is, I have seen her at conferences, and she is just so in tuned to people with dementia. It's just fabulous.
Wow, this is good information. So we have a comment here from Shamel. She says, "Wow, this is good information and scary all at the same time." Well, scary it may be momentarily, especially um, for those who are in the midst of perhaps this. However, it's helping us who are forging in today's present time. We can catch things, we can go back, right, Kim?
Right. Right.
Yeah, yeah,
Absolutely.
yeah.
And
This is
again,
good.
it's just being proactive. And I know it's easier said than done. Trust me, believe me. I do know it's easier said than done, but taking care of, the brain is an organ just like the heart, just like the lungs, just like the kidneys. It's an organ. We have to take care of it the best we can.
Yeah,
And we
and
take
not
care of
only
it by whatever's good for the heart is good for the brain.
absolutely, not only is it an organ, but Kim just named three of our many major organs.
Mhm.
Very important. I wish I knew then what I know now. Um, I did happen to meet Kim at a time where I really needed her support and her guidance. And, we are colleagues if we didn't mention it before. And I had set up um, a date for Kim to come and give some insight to my immediate as well as my extended family regarding this very topic because it very well um, hit close to home and probably still is with my extended loved ones. This is so important. Before we end, I'm going to post Kim, if you don't mind. I think we discussed it. We will post how to get in contact with Kim so that she can exercise her consulting abilities and be of service to you individuals who do inquire. You have anything else that you want to share with us, Kim, or do you want me to hit you with some more questions?
No, I did want to bring up real quick because there's a lot of talk out there about type 3 diabetes
Take your time.
um as a different as dementia. Type there is no there's just talk. So there is no, you're not going to go to the doctor and not going to diagnose you with this. There's just talk. But the idea is that there is insulin resistance in the brain,
Hmm.
and that brain cells are dying because they're not getting the required insulin that they need, creating dementia.
Wow.
And it kind of comes from people. There is a huge correlation in people who have type 2 diabetes and dementia.
So there's a correlation
Hmm.
between people that have those dual diagnoses.
Hmm. Yep.
What can they do to sustain and maintain? And hold on, and is there improvement? Can they improve?
Can you improve? That I don't have an answer for. I guess it would depend on your age, and where you are in the state of the disease. Um, but I don't have a good answer for that.
And
Can
that's
you?
okay.
Yeah, you can. Again, you can do those healthy habits to take care of yourself. And again, as we talked about, it's not easy. I get it. You know, exercise, eat well, exercise the brain just like you would exercise the heart and the lungs. It can help. It can help. But again, there's a huge correlation, and I think it's really on the tip of the iceberg with that connection.
Okay. I know that a lot of older people they love watching game shows, and they state that it helps them exercise their brain. I can recall when I visited nursing homes and therapy centers for older people, they love Scrabble and puzzles and definitely playing cards. I think
Mhm.
those are excellent choices to keep the brain strong and things of that nature. Am I right? Elaborate a
Right.
little bit on.
I'm sorry, that last part.
I said elaborate a little bit on that.
Yeah, so it does. It helps. Is it gonna prevent dementia or Alzheimer's disease? Probably not, but it could prolong you getting the disease. And the thing is, playing games, all that. But here's the trick. All right, and I've been guilty of this. Your brain learns patterns, and once it picks up on those patterns, you're not learning anything anymore. So you can do word searches, and they're fabulous and they're great. But once you've learned and you're doing the same thing over and over and over and over, it's just like lifting weights. If I always lift a 2-pound weight, I'm going to get so far, and that's all I'm going to get, right?
Right.
So you kind of have to challenge your brain, and you don't have to do anything fancy. Learn a new recipe, start driving a different way to the gym or to church, learn how to play an instrument, do something that just kind of challenges your brain to learn how to work that iPhone. Do something that challenges your brain and gets it out of that rut.
Okay, I like that. So these are some of the questions that I asked prior to days, maybe 2 weeks prior to our show. So listen to these array of questions and answer, as you will or as you see fit. Here goes. Um, where can I go to learn more about dementia? We answered that. What help is available to guide me through my illness? We spoke about that. If I have a problem that might be related to my dementia, who should I call? That we spoke about, but that's also easier said than done. So I would like to say, before Kim adds, someone that we can trust and that we have confidence in that will support us in that. What would you say, Kim?
Absolutely. And somebody that's not afraid to speak up. You need somebody
Like us, people like us, right, Kim?
Somebody that's going to go, wait a minute, hold on. I'm confused. You need to explain that to me in simple terms because I don't understand. You need to be able to do that.
That's right. That's right. And what if they can't? What if they don't have anyone that is that's in their life that can advocate for them?
That's tough because if they are not able to advocate for themselves and they don't have a good medical physicians, nurses, that kind of thing, unfortunately, those individuals may be ones that are just kind of shuffled around, end up in assisted living, and never really get the help that could help them. I know for me, and I suggest this for everyone. So my mother had dementia. My grandmother had dementia. My mother had type 2 diabetes. So genetically, I'm predisposed, right? So I get it. I actually have made for myself a care plan so that, and I have shared it with my children, so that should I get dementia, these are things, and they may change, but so I'm advocating for myself now while I can, that these are things that I like. For example, I like birds. I'd like for you to make sure I have a bird feeder outside of my room. I like flowers. That's therapeutic for me. Please let me dig in the dirt. I want you to take me out to eat once a week. Even if I embarrass you, please know it's the disease and it's not me. So I have a care plan for my children. Hopefully they'll do it. But I'm being proactive now before anything should happen. It may not, but that's okay if it doesn't. I'm prepared if it does, to the best I can.
I love what you said. So you said make a care plan
Mhm.
while you still have sound mind,
Mhm.
um, and allow it to be in the presence of other loved ones and witnesses, I would say,
Mhm.
so that hopefully they can carry that out. It
Yep.
sounds like something that may be uncomfortable, but
Mhm.
it sounds really wise to do. Just
Mhm.
like, have life insurance, have a will,
Mhm.
have what you would like. Now, my parents, um, One thing that I do remember my dad saying, and he still says it, when he came home from the hospital one year, and it was a very acute uh, experience that he encountered, to the point, he was in ICU and his heart was at 3%.
Oh, wow.
Yeah,
Wow.
yeah. This is how I know that we have a God. This is how I know that we have our supreme being, because one thing that I want to encourage those that are inquiring about this topic: we are mere mortals. We're humans, but the universe, the destiny of an individual lies in the hand of the Almighty. And I'm just going to say that because I mean it from my heart. When he came home, he got stronger and better, and even now he's doing wonderful. He said, "I don't ever want to leave home again.
Mm-hmm.
Whatever it takes, I want to stay home." So what does that mean? Uh, Financially, we have to bring what he needs in the home.
Yep.
Easier said than done, but evidently he's set up financially for that to occur. And
Mm-hmm.
some of it is occurring as we speak. So
Mm-hmm.
it is important to honor our loved ones' wishes as best we can. And I heard you said, "I hope my children follow it." And we are following it to the best of our ability. And we just have to govern ourselves accordingly, if that makes sense.
Absolutely. Absolutely. And I
Yeah.
want to say too that for people who don't have like a loved one, um, there are groups, some churches are really grasping on to aging ministry. NCBAM, North Carolina Baptist Aging Ministry, has a huge aging ministry, and they're actually starting these care communities. Um, and I was involved with an organization years ago called Love Inc., and it stands for Love in the Name of Christ.
It's called Love Inc.
Love Inc., Love in the Name of Christ. And they formed these communities where they had 5 people on a team, and say there was, and it didn't necessarily have to be an older adult, but someone in the community who needed some care. They would go take them a meal. They would share a meal. They would do light housekeeping. They would just be a human presence there. They would be eyes on the individual. So creating these care teams for people is tremendous.
I agree. I remember you just mentioned people can look in their various neighborhoods, communities, boroughs, counties, towns, or cities. Here in Eastern North Carolina, in Greenville, we do have a location. It's
Mhm.
called Council on Aging.
Mhm.
So that's a place that older individuals or someone that's trying to assist someone, that's where they can go. I
Mhm.
stand by it. You have utilized it for both my parents, and I need to tip one in there for myself. Because they offer yoga and exercise and things of that nature.
And
So
see, the Council on Aging senior centers are such an underutilized resource that
such an
are
underutilized,
wonderful. They're wonderful
such
things.
an underutilized resource, right?
Yeah,
And
I've always said, man, I can't wait to go to the senior center. I want to go in there and knit and crochet with them and just hang out. Looks like fun to me.
it does. It looks like fun to me as well. I want to read a few more of these questions that I got when I did my foot walking for the show. One of the questions was, when will I need to get help in the home, or do I have to go to a facility? Another person said, should I tell people about my diagnosis? Because I'm a little ashamed. Another one said, should I continue to interact with people even though they might notice that something about me is different?
Mhm. And I think this is why it's so invaluable for people like you, for shows like this, to educate us about dementia, about disorders. Why, you know, and it hurts my heart to think that someone would be ashamed that they have Alzheimer's disease or frontal temporal disease. It's the same kind of stigma that we see with mental illness. It's a brain disorder, no different from a lung disorder. It's just not. But we still have that huge stigma. How do you break stigma? You got to start talking about it, and you got to stop being ashamed of it yourself. And you just got to step out there and say, no, this is real, and we're going to talk about it. That gets it out there. But there's there's still a huge stigma associated with, and I guess it's because I guess I don't know if it's an American culture, but we like to be independent and in control.
And secretive.
Uh-huh.
And secretive.
We live in these little silos.
How many times have I went to a funeral service or a homegoing service? Nobody knew. Nobody knew. She never told me. He never told me he was sick. He never told me. Well, to some degree, I understand. But if there's someone that you're hiding this information from, that you know are people sort of like Kim and myself that are, let me say, movers and shakers, that have resources, that knows how to pick up a phone and identify links and supports, then I do believe that those individuals should muscle up enough courage to disclose to them.
Mm-hmm.
I just feel that it saves a life. But you're right. We are in a culture. We are in a culture where we don't want people to know. Why? It beats me, because I shout from the mountaintop.
I do too. But if you think about America itself, we are very independent. If you're not independent, it is seen as weakness, which is so untrue, but we see it as a weakness, unfortunately.
Unfortunately. So hopefully, shows like Access Your Inner Wisdom and all of these supports. We're living in the 21st century today, ladies and gentlemen, where we can dial just about any number for any type of help. Even these social media, they have support groups. I know with my personal diagnosis, my family loved me and they cared about me, and they had poor to no insight into my acute chronic disease. None. It's not their fault. They just don't know. Many people don't know. And I have to tell you something. Doctors don't know the field. I've ran into them even as early as today.
Oh, wow.
Even as early, and it happens. This is like the second doctor that didn't know about my diagnoses, simple things that I learned. Because the truth is, I didn't know about my diagnoses either, which, for those of you who don't know who I am, I have a kidney transplant that we'll talk about next month. But doctors didn't know. So it's important to utilize the World Wide Web. We utilize these devices. We utilize these devices for all the wrong things, most times. Well, how do I look it up? Whatever's in your mind, type it. Type it.
How do you'll find it?
Just type it. And I'm saying that to say this. My family loved me and everything. They just had poor insight. I started joining groups that were being challenged with the exact same disease I had.
Oh, wow.
So those of you who have family members that may have dementia, and most times they're elderly, so they're not going to do the homework. But by golly, you can. Right? Kim, we have people that are up all night on these devices. Who takes a moment to key in whatever it is that may be ailing your family member? Hopefully this is a reminder for them to do so. Yes, Kim?
Yeah, I agree with you 100%. And, we've just got to be, again, I can't say enough, proactive and educating hey, doctors don't know everything. Sometimes we have to educate them. I'm amazed, having worked in the mental health field as a therapist. And when I ask people, so you've been in therapy before? Yes. So have you seen a psychiatrist? I have. What was your diagnosis? Oh, I don't know. They didn't tell me. You're taking a psychiatric medication, but you don't know what your diagnosis is? And a lot of that is the doctor didn't tell them and they didn't ask. We just took it. So being proactive. And again, if you're not getting the answer you feel is correct, you know your gut better than anybody. You know you better than anybody. If it don't feel right, go find somebody else.
That's right. You're exactly right. Another question that hit the questions that I have posed out, which we answered, and I'll reiterate. How should I select a family or friend caregiver? What we forementioned. Kim said it. Someone that can advocate for you. Someone that is diplomatic and able to speak up and question things. And as I forestated, find someone that is resourceful, that is outspoken, that has resources and is tied in with the community. And that takes us into another thing. We have these aldermen and these councilmen and these mayors. We have a voice to get some assistance. And I don't ever want the geriatric field to be a forgotten population. I don't want that. And I'm grateful for GPAC TV 23 and all of our linkages together, because we make sure that we include those that are endowed with years of wisdom. We don't forget them. And I think that my words should be echoed into the ears of those that watch this and listen. Kim, what do you say?
Yes, I agree 100%. I know we're probably running out of time here, but I did want to share something real quick. It doesn't necessarily have anything to do with aging,
Sure.
but it can relate to aging. So I was recently on the Outer Banks with my granddaughter, and we had stopped at Taco Bell for lunch. And it was a wonderful guy at the register. He was so friendly. We talked about grandbabies. It was fabulous. And I was sitting at the table eating, and he came out at the drink machine and the trash cans, and there was a gentleman there. And the guy at the register said, "Man, you okay?" He said, "Yeah." Why? He said, "Well, I don't know. You look kind of down today. You're usually real chipper. I just was checking on you." And he said, "No, I'm good. I just got a lot of things on my mind." But it made me think how important it is. We have got to start being kind, and we have got to start, and it is so taboo in our society. We've got to start saying, "Are you okay?" I mean, this man, by asking that question, could have saved someone's life. And
Okay,
as a community, we've got to start looking out for each other, I guess is what I'm trying to say, is older adults, help them out. You and I had this conversation before. When they say,
Yes,
"I
yeah.
don't need anything." No, you know they do. The grass hadn't been cut. Go cut the grass. Don't ask,
Right.
just do. We've got to look out for each other. And I just want to drive that home that I'd rather somebody say, "Mind your business," than
Okay.
to not ask.
Okay. Thank you so much, Kim,
Thank
for
you.
gracing us with this hour, with all the information that you have. I want to shout out Brian Lassiter, who joined us. I have he sent us a heart of love. I want to thank Shermel Berry, who joined us on this live. This certainly will be re-aired over and over again. As forestated, we are on most social media platforms. We're on GPAC TV. You can find us on YouTube, Roku, right here on Facebook. It will be repeated. I want to thank Eva Maria Mercer and Dr. Deborah Daniels from the Garden of Healing. They all were a part of this live broadcast, and probably many more that I wasn't able to pick up your name. But for those of you who want more information about this astounding, well-informative, wonderful guest of mine, Kimberly Williams, you can certainly see her. You can contact her through her email, which is, I'm going to put it up
I
right
typed it
now.
in the chat.
Okay, and we are about to close out this portion of Access Your Inner Wisdom with your host, yours truly, Chariesse Boyd. Join us again for our next topic. For tonight, I say thank you, Kim, so
Thank
much
you.
for giving us a little bit of insight on what we need to know regarding aging, dementia, and how individuals can allow their golden years to roll on with
Mhm.
insight, support, and love. This is
Right.
Chariesse Boyd with GPAC TV. We thank you for joining us. We'll
Thank
see
you.
you again.